FDA is expected to authorize COVID-19 vaccines for children ages 5 to 11 soon. University Health has been on the forefront of providing care and prevention throughout the pandemic and stands ready to provide them to young children too. Here to answer questions about this latest development is Dr. Mandy Svatek, pediatric hospitalist with University Health. Welcome, welcome, doctor.
Thanks for having me.
Okay, so why has it been taking, just a little bit longer, of course, to authorize vaccines for this age group?
Right, so we first tested vaccines on those that were most vulnerable. And when we had to go through that, we had to go through 3 phases of the trials. And so the children, they are doing the same. It's just that there was a little bit of a lag because they had to get through the adult population first. And then there were some side effects that they were examining and assuring, some of the side effects associated with, such as myocarditis, which is inflammation of the heart muscle, were associated with the vaccine, but they had to look at that further. And they had 1,200 cases of over 398 million doses given. And so that was really rare. And we think about COVID and them developing myocarditis from COVID, those cases are substantially more. So they had to put all that together and make sure, plus the amount of dosing that they give, that it was safe and effective.
So some folks might be thinking, okay, well, it seems like kids don't get as sick from COVID as adults, but is it still important for them to be vaccinated?
Right. So first, me as a pediatric hospitalist, I've seen kids in the hospital sick with COVID pneumonia and COVID-MIS-C, the multi-system inflammatory syndrome of childhood. And we've had, over the United States, over 300 deaths associated with children with COVID. So you don't want that happening. So first and foremost, you have to think about that. You have to think about, one, assuring that it's safe and effective and protecting those that are around you. And so you don't want that child getting COVID and spreading the disease to somebody else. And then you want that child being in a nice environment to resume their daily activities and not getting COVID and having to quarantine. So that's why it's so important that our kids do receive the vaccine.
What's the best way to kind of explain the vaccine to kids?
Right, so we think about, the common vaccines that we do vaccinate against. The flu vaccine, so those are real live time, thinking about strains and when we need to receive that. They think only a few months ahead of time. So by the time that January rolls around, they're thinking about the next strain that they have to cover for. There's a lot of similarities. So they're trying to make sure that we cover for the appropriate strain, that it's safe and effective. And we want to protect them and we want to protect those around them. And so if we explain that and how it provides safety and effectiveness, I think our children would learn to understand.
And we have about 30 seconds left, but your daughter was part of a COVID vaccine trial. Tell us about the decision to do that.
Right, so we have to weigh in the risks and benefits. We have to understand that that's a hard decision, but we have to rely on science. I'm a physician, and that's how I practice medicine. And in order to protect my child, sometimes we have to contribute to that science. And so that was something well thought out within our family so that we could protect, not only our family, but our own child against COVID.
And that's what you said, your mom, not a gambler, right?
Right, not a gambler.
All right. For more information on University Health, call 210-358-4000 or visit universityhealthsystem.com.